Alright guys, so we're writing a whole essay on the concept of Lassa fever. Alright, whole concept, essay on the whole concept of Lassa fever. Okay, so when you're asked to write an essay like this, you usually give the staff tips on what they should be expecting from your essay. Okay, so Lassa fever is a big topic. Okay, so talk about the causes, that's etiology. Talk about the epidemiology, that's areas in the world which are affected by this. We'll talk about how it is transmitted. Talk about the risk factors and individuals that are at the risk of developing Lassa fever. Okay, then we'll talk about the pathogenesis. Talk about the clinical features, that's like the signs and symptoms. We'll talk about the differential diagnosis of Lassa fever. If it is not Lassa fever, it could be this. We'll talk about complications. We'll talk about diagnosis, the treatments and possible management for Lassa fever. So for the introduction, first of all, you see that Lassa fever is a type of what? Viral hemorrhagic fever that must actually be notified. Okay, so there are viral hemorrhagic fever. They are a group of febrile illnesses that can be caused by RNA viruses from any of the four families: Arenaviridae, Bunyaviridae, Filoviridae, Flavoviridae. Okay, so the hemorrhagic viral fever is usually characterized by fever. Generally, I feel like unwell, that's malaise, vomiting, and also bleeding from your small vessels. Etiology: it is an acute illness that's within 1 to 4 weeks duration, caused by a single strand RNA, belongs to the family of what? Arenaviridae. Okay, so its reservoir is the rodent of the genus what? Mastomys natalensis, commonly known as a multi-mammate rat. See the rat there. So first case was diagnosed from a village in Borno State called Lassa. So that's why they actually named it Lassa fever. So we are now talking about the epidemiology now. So it affects countries like Nigeria, Guinea, Liberia, Sierra Leone, Senegal. Cases are also reported in Central Africa, Mali, and Congo. So incidence is at 100 to about 300 cases per year in endemic areas in West Africa. Mortality about 200 deaths per year in West Africa. Affects all age groups, sex and races. Has seasonal clustering. So usually affects people more in late dry rainy season, and also late rainy season and early dry season. Okay, so moving forward, transmission is through the rodent to the human. Right, so exposure to infected mastomys rats, both direct and indirect. Hunting and consumption of animal rodent for food in endemic areas. Inhalation of what? Aerosolized virus. Then human to human transmission, like through direct contact with the person or their bodily fluids. Needle, stick or cut. Airborne, to be speculated. Then sexual transmission. Okay, so risk individuals is just people that are living in rural areas where the mastomys are found, especially areas of poor sanitation and crowded living conditions, or healthcare workers or care providers for the Lassa patients, okay, in the communities. So what's the risk factors? Poor environmental sanitation, bush burning, okay, poor housing standard, improper food storage techniques, hunting and consumption of rodents, cultural practices that usually promote contact with infected corpse. Okay, so pathogenesis is poorly understood though, but it has to do with an infection, right? So infection does for at least the Lassa organisms should get into at least 1 to 10, okay, of the organisms. They can enter the body via different routes: oral, mucous membrane, parenteral, accidental, inoculations, inhalational, or sometimes through sex, right? So there's pantropism for virtually all organs due to virus affinity for alpha D receptors present in most tissues. So viral hemorrhagic fevers attack monocytes, the macrophages, dendritic cells, present in all tissues of the body. There's a widespread of pro-inflammatory cytokines, interleukin, tissue necrosis factor, interleukin 6, nitrous oxide, and the rest of them. So there is down-regulation of immune system, such as decrease in interleukin 6 and also impaired B cell response. The hemorrhagic manifestation occurs as a result of thrombocytopenia or severe platelet dysfunction along with endothelial dysfunction. There's increased vascular permeability, it's common, and may result in periorbital edema and hemoconcentration. There's necrosis and hemorrhage in most organs. Hepatic involvement is most prominent. So clinical features of Lassa fever is, just so you know, that incubation period is 5 to 21 days. Alright, sometimes most people, in 80% of cases, they will be asymptomatic. Onset of disease is gradual. There's fever, general weakness, and malaise. So after a few days, you can have headache, sore throat, muscle pain, chest pain, nausea, vomiting, diarrhea, cough, abdominal pain. Severe cases can cause facial swelling, fluid in lung cavity, bleeding from the nose, your mouth, bleeding from vagina, bleeding from the gastrointestinal tract, low blood pressure, all of that. Last stage usually characterized by shock, seizures, tremors, disorientation, confusion, deafness in 25% of patients. During recovery, transient hair loss, gait disturbances may occur. Death occur within 14 days of onset in fatal cases. So disease is severe in late pregnancy with maternal death or fetal loss. In children, can cause swollen baby syndrome. So most sensitive indicator in pharyngitis, though. Most sensitive indicator is pharyngitis, but it's not actually specific. So differential diagnosis, it could be malaria, it could be typhoid, it could be yellow fever, it could be measles, it could be other hemorrhagic fevers like Ebola, Marburg. So different diagnoses could be blood or the specimens used is blood, urine, saliva, then cerebrospinal fluid, pericardial fluid, pleural fluid, semen, breast milk. Specimen collection and transport. Well, this is all there. So diagnosis method, you can use serology, ELISA. Culture, we are trying to isolate the virus. Then molecular diagnosis using the RT PCR, which is basically the gold standard. So that investigation could be full blood count, liver function test, electrolyte urea and creatinine, all there. So treatment is usually isolate the patients, right? Then they usually trace the people that have had contact with you. Then Ribavirin is the only drug with therapeutic efficacy if initiated early. Supportive management like maintenance of fluid and electrolytes, blood or whole blood or blood products transfusion, oxygen or mechanical ventilation, dialysis is indicated, antibiotics can be used, then steroids can also be used. So that was just the whole package on Lassa fever.